Hello, my name is Cheyenne Purtee and I'm going to be conducting a pediatric physical assessment today. I'm going to be following my general safety principles and practices throughout this assessment, so let's get started. So here today we have a 1-month-old baby boy. Initially I'm going to enter the room, make sure that the environment is appropriate enough for the assessment, make sure that privacy can be maintained. I'm also going to check the demeanor of the infant, the demeanor of the guardian, and the two's relationship. I'm going to assess the baby's clothing, see that it's appropriate for the weather, and I'm just going to make sure that overall the baby looks to be in good health. So to start the assessment, I'm going to get some vitals. Once the vitals are taken care of, I'm going to ask the guardian to undress the infant. Once the infant is only in its diaper, we're going to go ahead and place it on the scale. So once you've transported the baby to the scale, you want to remove the diaper and keep your hand above the infant just enough to hover it. 1-month-olds do not move around as much as older infants. They aren't as mobile, so the likelihood of one of them falling off is low, but we still want to just keep the hand above there for safety. Once the baby's weight is obtained, we can go ahead and take a quick peek at the genitalia while the baby is already undressed. Look at these gluteal folds and make sure that they are symmetrical. If they're not, they can it could mean that the hip is displaced. You want to check that and see if this baby boy is uncircumcised or if he's circumcised. If he's circumcised, you want to make sure that the circumcision is healing properly, and if he's uncircumcised, you want to make sure he doesn't have any complications with his foreskin, any rawness, irritation, things like that. And just check for quick diaper rash or irritation, and ask the parent or the guardian how they're handling that irritation. So once that assessment's taken care of, you can go ahead and cover the infant back up so that way they don't have to be completely exposed the rest of the assessment. So once the baby's diaper's back on, you're going to place them on a length board. This way we can get a good length measurement. You want to measure from head to toe and keeping the leg you're measuring as straight as possible to ensure you get an accurate measurement. So we're going to start from head to toe, and this infant is 21 inches long. That is a good length for a infant this age. While we've got our tape measure out, we're just going to go ahead and assess the circumferences. So we've got the head circumference, which is about 14.5 inches. The chest circumference, you want to scoot this carefully behind the baby's shoulder blades and at the nipple line. The chest circumference is about 13 inches. And then to the level of the umbilicus, you want to lower this strap, measure at the level of the umbilicus, and this baby's abdominal circumference is about 14 inches. So all of these measurements are within good range for an infant at this age. So once the length is taken care of and all the measurements are done, we can go ahead and begin assessing this infant's head. So infants have soft spots. They have anterior and the posterior fontanelles. These fontanelles close at different times. The anterior fontanelle closes within 12 to 18 months of age, and the posterior fontanelle closes within 6 to 8 weeks. So a 1-month-old infant is not old enough to have the either one of the fontanelles closed. So soft spots are still normal, and that's a normal finding. However, what's not normal would be if one of these fontanelles was sunken in. That's an indication of dehydration in the infant. If the fontanelles are bulging, that is an indication of fluid overload, so we would want to address that accordingly. And if these fontanelles are bouncy, that's an indication of shaken baby syndrome. So we just want to address those findings accordingly, but this baby's got good normal, soft fontanelles. So moving on from those, you want to check and make sure that the hair is evenly distributed. You want to look at the texture, the color, making sure that the facial hair, the eyebrows and eyelashes is distributed appropriately, which it is. The scalp is not wet to the touch or super dry. There's no evidence of cradle cap, and the baby's head looks to be in good condition. There's no issues with its skin. So moving on from the head, you want to check the eyes, ears, mouth, and nose next. So to assess this baby's eyes, we're just going to check and make sure that those pupils are equal and reactive to light, which they are. You want to check and make sure that there is no drainage on the eyes, and you just want to make sure that overall the eyes look and appear normal. Now for the ears, you want to check and having the baby move from side to side, because babies at 1 month old can move their head from side to side. You want to check for any blockages. You want to check that ear canals, observe the eardrum. You want to check for earwax or any other sorts of drainage, things of that. At this point, you can also perform this to see if they have the startle reflex, which is where you would just clap and the baby would spring its hands up as a startled motion, which indicates that the baby is able to hear. And then you also just want to check any other reflexes, such as the grasping reflex or the rooting reflex. Those are all still going to be present with an infant this age. So once the ears are good and you can indicate whether or not the baby can hear well, you want to go ahead and move on to the nose. You want to check and make sure that the nose is clear of any blockages, that the septum is not deviated, and that overall the nose is within normal limits, as well as the ears. For the mouth, you want to just check and make sure that there is no blue tint around the mouth or the ears. That can indicate, or central cyanosis, that can indicate some circulation issues. You just want to make sure that the oral mucosa is pink and moist. And overall, if this baby is too young to have any teeth, but should they be of teething age, you would further document the number of teeth. So overall, you just want to make sure that the baby's face is symmetrical, that the ears are not too far lower than the eyes. That's an indication of Down syndrome. But you just want to make sure that overall that the baby's features are symmetrical and within normal limits. So now that we've assessed, the head, we're going to go ahead and move on to the neck. We're going to assess these lymph nodes and just make sure that they're not palpable, not tender. Make sure that you can tell the baby isn't at any discomfort when palpation is underway. You also want to check and make sure that in these neck folds the baby may have, that there is no redness or irritation. That can be from drool, or it can be from milk that just dripped down into the neck folds and wasn't properly cleaned. You just want to address any redness or irritation with the baby's skin. That way it can get taken care of. If there is redness or rashes, you just want to make sure that the parents or the guardians are treating it appropriately with the correct ointment and that it's been assessed and documented. So once we move on from the neck, we are able to go to the cardiac assessment. So for this, you want to just make sure that the baby's pulses are strong. All of these can be checked bilaterally. Aside from the carotid, you don't want to do a bilateral carotid assessment. However, you can check the temporal here, bilateral. You can check the carotid one at a time. You've got the brachial right here in the upper arm, the radial here at the wrist. You can check these bilaterally. You have the femoral pulses here on the upper thigh. You may have to remove the diaper or push it out of the way for this one. You have the popliteal pulses behind both knees. And then you have the dorsalis pedis here on the top of the foot, and on the interior ankle, you've got the posterior tibialis, and these can be felt bilaterally as well. So once the pulses have been assessed and you can determine that they're within good range, we can go ahead and take a look at the capillary refill as well. Just check to make sure that it's less than 2 seconds for each extremity, which is good. And while you're looking at the extremities, just make sure there is no discoloration. We already checked for central cyanosis, but you want to check the distal extremities for any blue discoloration. which this baby is fine. So now we can go ahead and listen to the heart sounds. You've got the aortic, the pulmonic, tricuspid, and mitral. And Erb's point can be heard in the middle here, right here in the middle. So the heart sounds are good. So overall, this baby's cardiac system seems to be working well. There are no murmurs that were noted. So we're able to move on to the respiratory assessment. So babies are abdominal breathers. When the vitals were obtained earlier, we would have went ahead and noted the number and the quality of breathing, making sure that the work of breathing is within normal range for an infant this size. And we also want to just make sure that the chest and the abdomen are moving in a symmetrical pattern, that one's not lopsided. So for respiratory, after you assess those things, you want to go ahead and listen to the 10 spots on the front. There are 4 sides on each side for the lateral locations. And then there are 10 posterior locations for the respiratory assessment as well. So once the respiration and the respiratory assessment is conducted, we can go ahead and move on to the abdominal assessment. The first thing you want to do is you just want to inspect the abdomen, look for any discoloration, contortion, things like that. You want to go ahead and after you inspect it, you want to look at the umbilicus, ensure that it's midline and symmetrical, and we're going to go ahead and listen to the 4 bowel quadrants. Bowel sounds were active in all 4 quadrants, which is excellent. So the next thing you want to ask at this point is you want to ensure nutrition. You want to ask the guardian how many ounces a day the baby gets, how many bottles that equals out to, if they're going to the bathroom regularly, if they have any issues with eating, swallowing difficulties, if the guardian has noticed any abnormalities with bowel movements, things like that. If the baby seems to be too hungry after feeding, or if they're just not eating enough, they feel, things like that. If there is no appetite, once you do that, you can go ahead and palpate the abdomen and just feel for any abnormalities, masses, things like that, if it's distended. And then you would percuss if necessary. So moving on down back to the genitalia region, we've already assessed that in the beginning. However, we can ask the parent or the guardian if there's any, how many wet diapers the baby goes through a day, how many bowel movements they have per day, do they have them every day, do they go days where they don't have it for 3 or 4 days, things like that. Just bowel elimination patterns, urinary patterns. And we also just want to ask and see if there's any discoloration or odor that's foul to the elimination in the waste and things like that. And then we've already assessed for rashes. So the next thing we're going to do is assess the baby's musculoskeletal system. So you want to just check with these extremities, check their range of motion, see that they can bend and move freely. You don't want to force any movements, but you just want to get an overall assessment for how well the baby can move their joints and how well they can move all these extremities. Fingers and toes count too. So this, a baby at this age, like I said earlier, can grasp and they'll root. They should be able to startle, move. As long as the baby is moving and functioning well, they're moving their head from side to side, they're hitting those regular milestones, watching parents' faces, crying, they are establishing their need cries, the differentiating cries. And once you get an overall look at the skin and there's no bruising, no redness, no irritation, addressing those if need be, you just want to make sure that overall this baby's skin looks good, and checking the temperature and the dryness of the skin. You don't want it to be too dry, but you don't want it to be moist all the time too. So overall, this baby checks out good. The assessment's complete, and I appreciate you for taking the time to watch this video. Thank you.